Welcome to the Good Gut Project, where we decode new science and dive into gut health. Today, we're taking a closer look at something many of you might face: surgery, specifically gastrointestinal and abdominal procedures.
Right.
We've gathered some research exploring the potential role of probiotics and symbiotics, around the time of these surgeries. Our mission today is really to unpack this information and see what it could mean for your recovery.
Okay, let's get right to it. First off, just so we're clear, probiotics. These are live microorganisms, good bacteria, basically. If you take enough, they can provide a head benefit, lend a hand in your gut.
Got it. Beneficial bugs.
Exactly. And then symbiotics, that's a combination. You've got the probiotics, the good bacteria, plus prebiotics.
Yeah.
And prebiotics are like the fertilizer, food for those good bacteria, non-digestible stuff that helps them thrive.
Okay, probiotics and then the combo, symbiotics. And a big concern, obviously, with gastrointestinal surgery is infection afterwards, right?
Oh, absolutely. Postoperative infection. It's a major focus for surgeons and medical teams trying to prevent it.
Which is where this research comes in.
Precisely. The big question is, can these nutritional tools, these probiotics and symbiotics, potentially lower that risk? Can they help people, bounce back better after surgery?
So for this deep dive, we looked at some pretty solid sources: systematic reviews, meta-analyses.
Yeah, the heavy hitters. These aren't just single studies. They combine results from lots of different research papers. Gives you a much wider view, a more reliable picture of what the evidence is actually saying.
Helps to see if the same findings pop up again and again across different groups.
Exactly. Consistency is key.
All right, so let's dig into those main findings. One of the really striking things was this idea of reducing overall infections after surgery.
Yes, that definitely stood out. There was one quite large meta-analysis from 2017. It looked at 28 randomized controlled trials, good quality studies involving over 2,500 patients.
Okay, decent numbers.
Yeah, and what they found was, well, the rate of infectious complications was lower in the patients who got probiotics or symbiotics compared to those who didn't.
And it wasn't just sort of vague, right? They pinpointed specific types of infections.
They did. They found notable reductions in respiratory infections, urinary tract infections, and also wound infections.
Okay, so actually breaking it down.
Right, and they put numbers on it. For respiratory infections, the odds were cut by more than half, 56% lower. Urinary tract infections, even better odds, reduced by a whopping 70%.
Wow.
And wound infections, around 42% lower odds. So pretty significant drops.
Those are quite compelling figures, and I think we saw similar things in another big analysis, too, from 2020.
That's right, yeah. A more recent one looked at even more studies, 34 trials, over 2,700 participants. And again, it confirmed a significant drop in the risk of infectious complications overall, about a 44% reduction in risk.
Still a big drop.
Definitely. And what was really interesting in that analysis was a suggestion that maybe symbiotics, the combo, might be even more effective than just probiotics alone.
Oh.
Yeah, they saw a slightly greater reduction in infection risk with the symbiotics compared to just the probiotics.
Yeah.
So that combination approach might have an edge.
Okay, so fewer infections is a huge potential benefit, but it doesn't stop there, does it? What about things like how long you're in hospital or how long you need antibiotics?
Right, exactly. Because those things matter a lot for recovery, too. That 2017 meta-analysis we mentioned, it also looked at hospital stay, and it found that, on average, patients taking the probiotics or symbiotics had a hospital stay that was about 3 days shorter.
3 days, that's quite a difference.
It really is. And they also looked at how long antibiotic therapy was needed. That was shorter, too, by about 3.5 days on average.
Fewer days in hospital, fewer days on antibiotics. That sounds like a win-win.
It definitely points that way. And the 2020 analysis, the later one, it also found something similar, but specifically for symbiotics.
Just the symbiotics this time.
Yeah, in their analysis, it was the symbiotics group, not the probiotics only group, that showed a significant reduction in the total length of stay, almost 4 days shorter on average.
Interesting. So again, maybe that combo approach, doing a bit more heavy lifting there.
It seems possible based on that data, getting people home sooner.
Okay, let's shift gears a bit.
Yep.
Abdominal surgery obviously can really mess with your digestive system afterwards, your bowel function.
Oh, absolutely. Things can slow right down.
So what did the research say about probiotics and symbiotics helping with, well, getting things moving again?
Yeah, this is super important. There was another analysis, a network meta-analysis from 2023, looked at 30 studies, over 2,200 patients.
Network meta-analysis, how's that different?
Good question. It's clever because it lets researchers compare multiple different treatments all at once, not just one thing against a placebo. So they can compare different probiotics, different symbiotics, placebo, all in one go.
Ah, okay. More comparisons.
Exactly. And they specifically focused on bowel function after abdominal surgery.
And the findings.
Well, one key finding was about postoperative ileus. That's the term for when the bowel just temporarily stops working properly after surgery.
Right, that slowdown.
Exactly. And they found that probiotics significantly reduce the chances of that happening. Actually, their analysis suggested probiotics had the highest probability of being the best option for preventing ileus.
That's really encouraging news for anyone facing that kind of surgery.
It really is. They also looked at, the first signs of the bowel waking up like passing gas.
The technical term, flatus.
Right. And both probiotics and symbiotics were better than placebo or doing nothing at reducing the time it took for patients to have that first flatus.
So helping things get started sooner.
Yes. And looking further, probiotics specifically seem better than placebo for shortening the time to the first actual bowel movement, and also for reducing that uncomfortable bloating, that abdominal distension that can happen after surgery.
So it sounds like probiotics, maybe particularly, can really help kickstart the digestive system again.
That's what this analysis suggests. And interestingly, that same 2023 analysis found that symbiotics were better than placebo or no intervention when it came to reducing the total number of days spent in the hospital after abdominal surgery.
Okay, so maybe symbiotics have the edge on hospital stay in this specific context too. It's painting a picture, isn't it? These supplements potentially playing a really helpful role.
It does seem that way.
Did the research break it down even further, like specific benefits for certain surgeries, say colorectal surgery?
Yes, one of the sources we looked at did highlight colorectal cancer surgery specifically. It mentioned that in those cases, probiotics significantly lowered the risk of several post-operative complications. Things like pneumonia, urinary tract infections, surgical site infections, even serious bloodstream infections.
Wow, that's quite a list for that specific patient group. Very promising.
Indeed.
And it wasn't all just about the physical recovery either, was it? I think there was something about brain function, cognitive effects.
That's right, yeah. Kind of a surprising angle, maybe. Some studies have hinted that probiotics might play a role in reducing what's called postoperative cognitive dysfunction, or POCD.
POCD, like brain fog after surgery?
Sort of, yeah. It can happen, especially in older patients. And one specific randomized trial looked at elderly patients having non-cardiac surgery, and they found that the group receiving probiotics actually had a lower incidence of this POCD.
That's fascinating. How on earth could gut bacteria affect your thinking after an operation?
It comes back to that gut-brain connection, which is such a hot area of research now. The 2023 meta-analysis touched on the potential mechanisms. A big part is how these probiotics and symbiotics modulate or influence your gut microbiota, that whole community of bugs in your gut.
Okay, changing the balance.
Exactly, promoting a healthier balance. And by doing that, they can help regulate the body's immune response and, crucially, reduce inflammation, not just in the gut, but systemically throughout the body.
Ah, so less inflammation overall might benefit the brain too.
That's the thinking. Less inflammation potentially crossing into the brain or affecting brain function.
Makes sense. That gut-body connection again.
Absolutely. They also talked about strengthening the intestinal barrier, basically, making the gut lining tougher, less leaky.
So less bad stuff getting out into the bloodstream.
Precisely.
Yeah.
Which also helps dial down inflammation. Plus, they can just generally aid digestion and nutrient absorption. And remember, the prebiotics and symbiotics, they're the fuel feeding the good guys.
Yeah.
So symbiotics offer that sort of 1-2 punch.
The bacteria and their lunch.
You got it.
Yeah.
And specifically for that ileus, that bowel slowdown we talked about,
Yeah.
the idea is they might help by reducing those pro-inflammatory molecules that can actually interfere with normal gut movement. Calming things down allows the gut to get back to work.
Okay. And you mentioned something about short-chain fatty acids.
Yes.
SCFAs.
SCFAs.
Yeah.
These are really important compounds. They get produced when certain probiotics, especially strains like lactobacillus and bifidobacterium, ferment fiber, the prebiotics or fiber from your diet.
Okay, so the bacteria make these SCFAs. What do they do?
A lot. They're a major energy source for the cells lining your colon, keeping the gut wall healthy. They also have anti-inflammatory effects themselves. And they can even influence the composition of the gut microbiota. So these lactobacillus and bifidobacterium are like little factories in your gut producing these beneficial SCFAs.
So, multiple ways it could be helping out, modulating bacteria, reducing inflammation, strengthening the gut lining, maybe even reducing helpful compounds like SCFAs.
Exactly. It seems like a multi-pronged approach.
But there's always a but in science, isn't there? We need to be realistic. Were there caveats, cautions mentioned in the research?
Oh, definitely. Very important to keep perspective. That 2017 meta-analysis, for instance, explicitly stated that their results needed cautious interpretation.
Why was that?
They mentioned potential risk of bias in the studies they included, and also something called publication bias.
Publication bias. That's where studies with positive results get published more easily than ones with negative or null results.
Exactly. So it can sometimes skew the overall picture, making an effect look stronger than it might actually be. It's a common challenge in meta-analyses.
Right. Good to keep in mind. Always look critically.
Absolutely. And another huge point that came up repeatedly across the sources, this needs to be an individualized approach,
Meaning?
meaning you can't just say everyone having surgery should take probiotics. It's not one size fits all. The decision have to consider your specific health situation, the exact type of surgery you're having, any potential risks for you.
So talk to your doctor.
Absolutely essential. That conversation with your healthcare provider,
Yeah.
your surgeon, your doctor is crucial before considering using these supplements around surgery. They know your context.
Makes total sense. Everyone's different. Every surgery's different.
Precisely. And tied to that, remember, not all probiotics are created equal.
The specific strains matter.
Hugely. The effectiveness can really vary depending on the specific bacterial strains used and also the dose. What works in one study with brand X might not apply to brand Y with different strains or amounts.
Good point. You need the right tool for the job.
Exactly.
What about diet after surgery? You often get told to eat specific things or avoid others. Do probiotics or symbiotics change those dietary rules?
Based on our sources, not really. Those post-surgery dietary restrictions are mostly based on the surgery itself and your overall condition. It's about letting your digestive system heal, preventing issues like blockages. It's not specifically dictated by whether you're taking a probiotic or not. You still follow your medical team's advice on diet.
Okay. So, summing up, the research looks promising, quite promising actually, especially for GI and abdominal surgery. But we're not quite at the point of saying routine use for everyone.
That seems like a fair assessment. Yeah, the evidence is definitely building. It's encouraging. But more high-quality research is still needed. We need to really nail down the best strains, the optimal doses, the timing for different types of surgeries in patients. It's still an evolving field.
So, what does this all mean for you listening? The research, as we've heard, suggests probiotics and symbiotics could be valuable tools supporting recovery after these types of surgery. We've seen evidence pointing towards reduced infections, shorter hospital stays, maybe better bowel function, even potential cognitive benefits.
Yeah, the potential is definitely there.
However, and this is key, it's crucial to remember this is emerging science. As the studies themselves point out, we need more research, and what works for one person might not work for another. Your specific surgery, your individual health, they matter hugely.
Couldn't agree more. Context is everything.
The main takeaway here really is about having an informed conversation with your healthcare team. If surgery is on the horizon for you, ask them. Ask if probiotics or symbiotics might be appropriate for your situation. Discuss the potential upsides and any possible downsides based on your specific needs.
That conversation is vital.
And here's maybe something to think about. The gut microbiome, it's incredibly complex, right? We're really just starting to understand how these supplements interact with it, especially when the body is under the stress of surgery.
Oh, absolutely. We're just scratching the surface.
What other roles might the gut microbiome play in surgical recovery that we haven't even considered yet? How else does it influence healing, inflammation, maybe even pain perception? It's a field just wide open for more exploration.
There's so much more to learn. It's a really exciting area.
Definitely. So, to wrap up our deep dive today, probiotics and prebiotics may aid recovery after surgery, but this is still emerging science. They're not a replacement for medical care. Always consult your doctor before using any supplements. Every case is unique.